A 43-year-old woman comes to the emergency department with acute onset left-sided weakness. The patient reports increased fatigue, low-grade fevers, and occasional palpitations over the last 3 months. She has lost 6 kilograms during this period. She has no prior medical conditions and takes no medications. She does not use tobacco, alcohol, or illicit drugs. Temperature is 37 degrees Celsius, blood pressure is 120 by 76 millimeter mercury. Pulse is 80 beats per minute and regular, and respirations are 14 breaths per minute. There are no carotid bruits. The thyroid is normal in size and there is no tenderness. Cardiac examination shows normal S1 and S2 and a mid-diastolic rumble at the apex. The lungs are clear on auscultation. Neurologic examination shows left-sided weakness. Laboratory results show a hemoglobin level of 10.2 gram per deciliter and an erythrocyte sedimentation rate of 60. Brain imaging reveals multiple small acute infarcts in the right parietal and temporal lobes. Transthoracic echocardiography shows a mass in the left atrium. The question is, which of the following is the most likely diagnosis? Your options are A. Infective endocarditis, B. Intracardiac tumor, C. Left atrial thrombus, D. Myxomatous valve degeneration, E. Rheumatic mitral stenosis. Type your answer in the comment box. I'm guessing you didn't get the answer right. Congratulations if your answer is B, which is intracardiac tumor. This patient with acute onset left-sided weakness and a left atrial mass identified on echocardiography likely has an atrial myxoma. Myxomas are benign tumors and are the most common primary cardiac neoplasm. Approximately 80% arise in the left atrium. Fragments of a left atrial myxoma can embolize into the systemic circulation, leading to stroke or other acute ischemia like limb or mesenteric. Left atrial myxomas frequently obstruct blood flow from the left atrium to the left ventricle, leading to a murmur mimicking that of mitral stenosis, such that mid-diastolic rumble at the apex. The obstruction can also lead to decreased cardiac output that manifests as dyspnea, lightheadedness, or syncope. Because the mass is typically mobile, obstructive symptoms may be transient and influenced by positions such as mitral obstruction is exacerbated by upright posture but is alleviated by lying down. Tumor movement occasionally causes a characteristic tumor plop sound at the end of diastole on auscultation. In addition, some myxomas can produce cytokines like interleukin-6 that lead to systemic inflammation evidenced by an elevated ESR and constitutional symptoms like fever and weight loss. The diagnosis is typically established by echocardiography. Prompt surgical resection is recommended to minimize the risk of embolization and sudden cardiac death due to impaired cardiac output. If you chose any option other than F, you were incorrect. Let's briefly discuss the other options. Choice A cannot be the answer because although infective endocarditis can cause fever, weight loss, and systemic embolization, echocardiography typically shows valvular vegetations rather than an intracardiac mass in the atrium, as seen in this patient. In addition, infective endocarditis typically causes a regurgitant rather than stenotic murmur. Choice C cannot be the answer because left atrial thrombus can develop in atrial fibrillation and lead to systemic embolization. However, this patient's history of low-grade fevers, weight loss, and elevated erythrocyte sedimentation rate are more consistent with myxoma. Choice D cannot be the answer because myxomatous valve degeneration is the pathologic cause of mitral valve prolapse, which characteristically produces a mid-systolic click rather than mid-diastolic rumble. Choice E cannot be the answer because worldwide rheumatic heart disease is the most common cause of mitral stenosis, which produces a mid-diastolic rumble and can lead to atrial fibrillation and left atrial thrombus with systemic embolization. However, rheumatic heart disease is uncommon in developed countries. In addition, mitral stenosis typically develops years after the initial episode of rheumatic fever. Although rheumatic fever recurrences may cause fatigue and low-grade fever, such recurrences usually involve pharyngitis and are rare in adults. If you're finding this difficult to understand, consider watching this episode again.